asked to speak a little bit today about the value of a pre-hire physical exam or sometimes call it a pre-placement physical exam. I look at this really from the perspective of other parts of medicine where it's valuable to try to prevent a problem as opposed to just treating it after a problem occurs. So the value of a pre-placement exam is to determine if there are uncontrolled medical conditions or physical impairments that will allow the employee to safely do their job. This is a good preventative measure, and it's surprising oftentimes that we are the only medical contact that some of those employees have in their life. So it has been the occasion we've picked up undiagnosed, very serious medical conditions, and also more commonly just pick up some physical barriers that would lead these patients down the direction of an injury, probably in their first couple of months of work for an employer. So these exams can be tailored to the employer's conditions, specific to the job. It typically involves a very brief physical examination that's limited to the needs of the employer, and then also a fitness capacity exam that can reproduce some of the job tasks that the patient would normally be doing. And this basically gives a much higher confidence level that the patient can go into that work environment safely and hopefully prevent a work-related injury in the first few months of employment. One of the more common situations that we deal with in occupational health is a new employee that's injured within the first 30, 60, 90 days of their employment. And this poses a problem both to the employer, obviously to the employee with the injury, and we look to ways to remedy that. And one of the most valuable ways that can be remedied is looking back in the pre-hire process to see if that individual did undergo a basic physical examination and fitness capacity evaluation. And those two processes together can deem the patient safe to do the job, and in many cases would have been a way of preventing this individual from getting injured in a job that he or she was clearly not medically suitable to perform.
Every year, millions of workers in the United States experience an injury or serious medical problem that causes them to leave their jobs to obtain needed medical care or rehabilitation. Injured workers may present multiple challenges when determining the appropriate time to return to work. Ideally, the time away from work is temporary and short in duration, which minimizes any major disruptions for both the worker and the employer. However, according to the Job Accommodation Network, if an injured worker is off 12 weeks or more, the likelihood of him or her returning to work drops to 50%. Significant workers' compensation costs may encourage employers to push workers to return to work early. Returning to work too early could put a worker at risk for re-injury. Significant workers' compensation costs may encourage employers to push workers to return to work early. Returning to work too early could put a worker at risk for re-injury. Workers may delay return to work due to pain, fear of injury, financial considerations, lack of preparedness, and other factors. As you can see, this creates quite a dilemma. So how does a clinician decide when a worker is ready to return to work? A return to work physical examination. A return to work physical examination can help to ensure that it's safe for an injured worker to go back to work after an injury. If the worker is not ready, the provider helps determine when it would be right for the injured worker to return to work. The provider reviews the injured worker's medical, injury, and rehabilitation history, thoroughly examines the worker, and reviews the injured worker's specific job duties to determine what he or she can safely do and for how long. The provider documents any problems that may prevent an injured worker from returning to work or fully recovering. For the employer, he or she identifies safe working limits and gives them information on how to modify the job after an injury or create new ergonomic solutions. This reduces risk of re-injury. It is important for all parties to provide input in the decision to return to work. The employer should support the injured worker and make accommodations if able, and the injured worker should be honest about his or her improvement or any continued concerns regarding his or her return to work. This will create a positive environment as the injured worker returns to work. Working as a team will make for a more seamless transition.
Hello, we'll be talking briefly about the new OSHA silica standard. As you may know, Silicosis is a form of occupational lung disease caused by inhalation of crystalline silica dust. The most common form of crystalline silica is quartz, which is found in sand, gravel, clay, granite, and many other forms of rock. It mostly affects workers exposed to silica dust in occupations such as mining, glass manufacturing, and foundry work. Silicosis is characterized by inflammation and scarring lesions in the upper part of the lungs. The disease, particularly the acute form, is manifest by shortness of breath, cough, fever, cyanosis, or bluish skin. It may often be wrongly diagnosed as fluid in the lungs, pneumonia, or tuberculosis. Silicosis is the most common occupational lung disease worldwide, and is especially common in developing countries. In the United States, it is estimated that between 1 and 2 million workers have had occupational exposure to crystalline silica dust, and about 59,000 of these workers will develop silicosis sometime in the course of their lives. However, silicosis in the United States is relatively rare. The incidence of deaths due to silicosis has declined, and the cases are highly correlated to industry and occupation. Silicosis manifests in 3 forms. There is a chronic form that takes more than 10 years of low-level exposure to develop. There is an accelerated form which takes about 5 to 10 years of exposure, and an acute form that develops in months to 2 to 5 years of exposure. This one is usually fatal. Because chronic silicosis is slow to develop, signs and symptoms may not appear until years after the exposure. There is no cure for silicosis, but it can be prevented. In March 2016, OSHA updated the silica standard. The standard mandates that companies must provide certain safety measures for employees who work with or around silica in order to prevent silicosis, lung cancer, and other silica-related diseases. The standard provides flexibility to help employers, especially small business, to protect workers from silica exposure. Under the new standard, employers are required to follow a medical evaluation plan for workers who wear a respirator for 30 or more days per year. Under the surveillance plans, each worker that meets the requirement for testing must be offered a medical evaluation within the first 30 days of the assignment, and every 3 years after the initial exam, if the worker continues to meet the criteria of the exam. The aim is to protect all exposed workers, and mostly to those with the subtle chronic exposure to respirable crystalline silica dust.
I'm Jenny Kanapke, Certified Nurse Practitioner.
And I'm Jody Grover, Certified Nurse Practitioner with Mercer Health, Occupational Health and Wellness.
We are here to explain what a DOT physical is, how to obtain clearance to drive a commercial motor vehicle, and finally, what to expect at your physical appointment.
The DOT physical is designed to confirm that you are healthy enough to safely perform the job of a commercial motor vehicle driver. For the commercial motor vehicle, the most important safety feature, no matter how many bells and whistles your truck may have, is you.
Driving a 5-ton or larger truck is not like driving your regular passenger vehicle. Stopping time, distance, blind spots, and limited maneuverability require you to be at top driving performance. It is important to be alert to traffic changes and be able to make quick decisions, because by making the right decisions, you can save lives.
During your DOT physical, we will collect information about your physical, mental, and emotional history. We will ask you what medications you are taking, what surgeries you have had, what chronic conditions you are currently being treated for. In addition, we will ask about your use of alcohol or illegal drugs. As part of the exam, you will also be asked to give us a urine specimen. Be prepared for this and come to your visit hydrated. This is a separate test from the drug screening. The urine specimen allows us to look for things like sugar, protein, and blood in your urine. We will perform a head-to-toe exam as well.
In order to make the most of your appointment and be well prepared, we ask that you bring the following with you: your driver's license, your glasses, hearing aids if you have them, a list of all your current medications. If you are diabetic, bring a copy of your hemoglobin A1C completed within the last 3 months. Federal Motor Carrier Safety Administration now allows diabetics dependent on insulin to drive, but they require that a form be completed by your treating physician. This form can be found on the FMCSA website, or you can call our office and we can provide you with the form. If you have a CPAP machine, bring a printout of the last 3 months' usage. Any additional paperwork your employer may require as well.
We encourage you to be prepared for your appointment so we can avoid delays in getting your certification. Our goal is to make sure you are healthy, obtain the proper certification, and get you out on the road.